I think it's really important to, the example I use is you thinking about when you're a medical student, you're trying to do the arterial blood gas, right? And so you have to kind of do the work. You have to study. You have to do your due diligence. You don't just kind of walk around the ward with a needle ready to inflict that on somebody. You do the work. You read. In this, in this example, let's say doing like the cultural safety training, different types of learning and understanding, and also understanding like indigenous like strength and sovereignty and solidarity and art and like beauty and resistance and all of those things, um, but learning, and then with the help and of colleagues who are more advanced than you, getting into the action, as you put it, right? So the reconciliation. And so what that means is that you also in that process might make mistakes, and it's that, you want that fight or flight kind of, reaction can happen. Um, and I think in medicine, the way we get over that, when you're going to do an arterial blood gas for the first time, it might not work, but you're committed to learning because you want to save a patient's life. And when you do perhaps make a mistake and you poke a few times, that patient does not have to forgive you or say thank you for your bravery or whatever. No, they might be very ticked off at you, actually. But you stay committed to that work because you want to be a good doctor, because you realize that you want to save people's lives. You, with humility, apologize and you learn from your mistakes and try to do better because you know that it's critically important. You don't just say, well, I'm just not going to learn arterial blood gas. I might make a mistake. So I think it's the same thing with this work. Racism kills patients, right? Through either assumptions made about patients, the violence towards patient, or sometimes it's just the plain neglect and the dehumanization and lack of empathy. Joyce Echaquan is just the tip of the iceberg of these examples. So you have to understand that you have to do this work so that you can help your patients